in the classroom. They want to start doing what they're being paid to do, and that's teach our students.
The next question, the Leader of the Opposition.
My next question is also for the Premier, but I can tell you that the only thing that folks in Ontario are certain about is that this government's holding our kids' education hostage with their ideological way they're handling with this. But nonetheless, my next question to the Premier is that last night on CBC News, Ontario families heard the tragic story of Oula Jaber, a mother and grandmother who has been forced to live in a hospital bed, breathing through a tube for the last 2 years as she languishes on a wait list for surgery. Can the Premier explain to Ms. Jaber's family and to all Ontarians why anyone should have to live in a hospital bed year after year, waiting for procedures that should be available but simply never arrive?
Premier.
Minister of Health.
Referred to the Minister of Health.
Well, I thank the member very much for the question. This is a situation that we are aware of. Although I'm not able to discuss the particular circumstances, I am sorry for this woman and her family. I'm not able to discuss the particular circumstances because of privacy issues, which I'm sure you will understand. However, I am able to say that this was a very rare and unusual procedure. There are very, very few surgeons who are able to perform this procedure. So this was not anything to do with hallway healthcare. This had to do with the particular circumstances for this woman. Now, that's not satisfactory, but it was due to the medical procedure that this person needed. However, I can tell you that in terms of hallway healthcare, we are making strides. We do have a plan that is reducing the number of people who are receiving hallway healthcare. Those numbers are going to continue to go down in the future, and we are working on many fronts in order to deal with that.
Supplementary question.
Ms. Jaber has missed her daughter's wedding and the birth of her granddaughter while she languishes in a hospital bed. But her story is far from unique, regardless of the way this minister is trying to paint the situation. Earlier this year, I raised a case of Maria Konopeskis, an Ottawa resident stuck in hospital for 2 years while she waits for home care supports. The Premier said he would fix hallway medicine. Speaker, why are things going from bad to worse under the Conservatives?
Minister.
Well, thank you, Speaker. I wish to assure you, and through you, the Leader of the Official Opposition and the public, that this situation is not the norm. It had to do with this person's particular requirements for surgical procedure. But we are working to reduce hallway healthcare. As you know, this is not a simple thing to do. I am working with the Minister of Long-Term Care in order to create more long-term care spaces. We did make a promise that we would create 15,000 new spaces within 5 years. We're well on the track to doing that, because we need to make sure that those patients who don't need to be in hospital, the alternate level of care patients, are able to move out of the hospital. That has been a problem because of the previous government's inactivity on this file, their lack of creating those long-term care spaces that has allowed for this procedure to happen, allowed for this build-up of patients in the hospital. We're also working on our mental health and addictions plan to make sure that the patients who cycle in and out of our hospital emergency departments are not doing that anymore, that they're going to be able to receive the community mental health supports that they need so they don't end up in the hospital